believe this. Shocking results of a USA Today investigation have just been released, and it found that the United States is the most dangerous place to give birth in the developed world. I mean, take a look at these numbers. It found every year 50,000 mothers are severely injured during or after childbirth. 700 mothers die per year. So joining me to discuss via Skype, family physician Dr. Jennifer Caudle. Dr. Caudle, so good to see you. I was shocked here, wondering how is this possible? What did they discover in the investigation?
You know, Lynn, I was shocked as well. I actually can't believe it as a family physician. This USA Today report, the investigation, they were looking to see how well hospitals follow best practices when it comes to childbirth. They were looking at how well hospitals treat high blood pressure and bleeding in women who are giving birth, which are preventable, and treatable causes of complications. They looked at lots of documents. They talked to lots of women who'd had complications, talked to lots of centers. And what they found was that at least 50% of deaths during childbirth and a lot of complications might have been prevented with better care and with hospitals following certain guidelines when it comes to these particular conditions. So it's very startling. I feel that way too.
So you would think that our hospitals would be among the best. What do hospitals need to be doing differently?
Well, there's a lot of things. Right now there is no national tracking system for childbirth complications. In my opinion, as a family doctor, that needs to change. We need to know and be tracking the complications that are occurring around childbirth. The other thing, though, and this is something that the USA Today report often talked about throughout, is the importance of adopting national safety standards that are approved by medical organizations and associations, so that basically we have a protocol and protocols that hospitals need to follow to treat certain conditions and keep women safe during childbirth. Those things are very important, and we know that in states that that's happened in, their mortality during childbirth has gone down. So very important to do those things.
What about moms? Anything that they can do to reduce their chances of being injured or dying?
Yeah, and I mean, this is such a loaded topic. My heart sank as I was reading this report. It's really quite startling. And this is what I would say. I say this to all my own patients, is to trust your gut and to trust your body. I feel like patients, we know our bodies best, and you know your body best. If something is not right, don't hesitate to advocate for better care and for someone to look into what's going on. And the other thing I should say as well, and I want women and men to have that confidence. But the other thing is that this USA Today report does have a really important patient education document that can be found online, talking about questions you can ask the hospital and kind of look through and go through as you're choosing a birthing center and going about childbirth.
Speaking up, so essential here. Dr. Caudle, what was interesting to me in this investigation, it's not just that it's really high in the United States, it's that it's steadily increasing compared to other developed regions. Why is that?
It's honestly, I think it's baffling. I'm just speaking off the cuff and very sincerely. It's disappointing to me. It saddens me. And it's confusing. And I think it goes back to, at least in the report that was discussed by USA Today, these ideas that, again, we don't have national tracking methods for complications in childbirth. We need to be knowing and tracking this. We need numbers, and we need better safety standards. And there's probably, this is a multifactorial issue. Those are not the only two issues, but I think those are two big ones that may be playing a role here.
Well, and maybe this will be the launch pad for some of that. Dr. Caudle, as always, it's good to see you. Thanks for joining us.
Thank you.